agricultural production. 70% of our crops are now being affected by the extremes of climate, both drought and flood. And at both ends, we see toxic issues arising for human health and livestock, whether it's in the flooding conditions and the more, what I would say, moist conditions where aflatoxins and other kinds of microorganisms actually are impeding on the quality of food as it moves through the environment and as it moves through the trade routes, through storage. And at the other extreme, where we see a number of really important crops, whether it be maize, cassava, and others, that are actually responding to drought by turning on particular content of prussic acid, hydrogen cyanide, which is toxic to people and livestock. So the natural world is responding, as it would be expected to do, to these climatic extremes, and it's now having an effect on the very things that we eat. So we want to really think about not just the cause and effect, but what are we going to do? Do we change agricultural production systems? Well, yes, but if you're living in a very poor neighborhood, you're not going to have all the benefits of an industrial storage system. So this is really why ministers of environment are going to be challenged now to think of solutions that are part of the complexity, but at the same time not giving up on some of the simple solutions, because there are many simple solutions.
The world's poorest, about 3.5 billion people, tend to rely directly on the environment for their basic needs, such as water, food, and shelter. The degradations of these ecosystem services affect the poorest the most, as they have no alternatives. Climate change impacts add to this vulnerability, having different effects on the already endangered livelihoods and the safety of both men and women. As a result of the further reduced quantity and quality of water and sanitation, degradation of the soil, emerging and re-emerging diseases, loss of lives and properties, and natural disasters, and forced or voluntary migration. Over 500 million children live in extreme high flood occurrence zones, and nearly 160 million children live in areas of high or extremely high drought severity. Many poor countries are also particularly vulnerable to climate change impact, as are some indigenous groups, peasants and pastoralists. Exposure is particularly high among women and young children, who spend the most time near the domestic hearth. Children, the old, and those with low immunity are especially vulnerable.
It is unbelievable the extent to which people are literally living in conditions where they are inhaling every day vast quantities of smoke just because of fuel for cooking, open cooking, and so forth. So there's the environmental side of it, but there's also the human aspects. So we are set through our resolutions to tackle air quality, and we will continue to pay attention to it, both pervasively in the ambient air conditions, through transport, but also then through specific activities like clean cook stoves and so forth.
Environmental degradation is estimated to cause between 174 and 234 times as many premature deaths as occur in conflicts annually. A United Nations report says disproportionate impact of environmental harms are evident on specific groups. They are the poor, the young, the elderly, women, and migrant workers. The UNEP's Healthy Environment, Healthy People report indicates that lack of access to clean water and sanitation causes 58% of cases of diarrheal diseases in low and medium income countries. Unsafe water, inadequate sanitation, or insufficient hygiene result in 3.5 million deaths worldwide, representing 25% of the premature deaths of children younger than 14.
Well, ask the mothers who have to treat their children because their IQ was impacted by lead poisoning. Ask the parents who have buried their children because they died of asthma attacks. Ask the patients who are lying in hospitals and being treated for skin cancer because of what we had done to our atmosphere. Ask all those parents who lost their children before the age of 5 because of water quality. Ask the insurances, ask the taxpayers, ask the governments whether the price that we are paying as a society in the billions of dollars for the pollution that some cause for the many. And I think very quickly people will realize that when we have treaties and protocols and policies, when we promote cleaner technologies, safer chemistry, the conservation and protection of our ecosystems, which in turn sustain us, whether through clean water, clean air, or many of the other products, then very quickly you will realize that it is in our responsibility for also caring for that which we call nature, that we give expression to a human civilization.
Zika, Ebola, MERS, SARS, Marburg, and other new zoonotic diseases which are spread from animals to humans are currently emerging every 4 months, with the main drivers being exponential population growth, intensive livestock breeding, and this is because there are 36 billion domestic animals on the planet, and concomitant disturbed environment and biodiversity loss. Strengthening healthy ecosystems is key to preventing or slowing the emergence of these costly diseases.
What's changed is the way that we both have contact with livestock, our absolute pervasive use of antimicrobials and antibiotics, which is removing and reducing the kind of resistance that we see. And more importantly, is the fact that we have illegal trade of live animals. The fact is, it's happening. And when these animals are somehow transported, they are often released into the wild. Now, because it's illegal, there's nobody signing a sanitation. They're not embargoed, they're not put in quarantine. So these are literally movements of zoonoses moving around the planet. So this is just another compounding fact. On a world that has zoonoses, essentially we're swimming in them. Whether it's because we now envisage it as Ebola or Zika, but in the background we have epidemic zoonoses. You know, we have anthrax, we have pig tapeworm, we have many, many, many diseases. So we have those associated with big epidemics, but then we have a lot of them that are either neglected or just simply there in the background. So very, very important to think about that.
A key need is for greater investment in integrated surveillance of wildlife, livestock, and human health.